One-point relay. Hello, I'm Dr. Cho Yong seok of Opsun Dental Clinic. First, I want to thank Dr. Hang Sung-eun for recommending me for one-point relay. I remember when I first started one-point relay here 4 years ago. Many doctors have delivered wonderful lectures since then. Now that I'm back in one-point relay again, I had to contemplate the material that I wanted to discuss. Among the many topics that I want to discuss, I want to return to the basics and talk about basic surgical tools today on one-point relay. Every surgical procedure includes techniques that involve incisions, flap elevations, and flap retractions during surgery, and closing of the flap after the surgery. We'll take a look at the tools and techniques necessary in these steps. Preparing 2 types of surgical mesh during incision is recommended. Most people are familiar with mesh number 15, but using mesh number 12 is recommended in addition to number 15. Mesh number 15 performs an incision with surface contact, whereas mesh number 12 does so with point contact. In particular, performing a crestal incision with mesh number 12 allows us to create a clean incision line at once in an irregular bone environment. It may be unstable due to its point contact nature, but we can obtain a cleaner, more precise incision line if we move the mesh with a firm finger rest. After the incision, we must elevate the flap, and it's important to use a good periosteal elevator. The most frequently used periosteal elevator is number 9 mold, which has an extremely sharp side and an extremely large dull side. You'll be skilled once you've familiarized yourself with the tool, but the tool itself is far from perfect. The tool I use the most is a periosteal elevator called P24G. It's relatively thin and very hard. We can perform detailed flap elevations using P24G. This elevator allows us to perform significantly cleaner and easier flap elevations. I strongly recommend using this P24G periosteal elevator. It's important to retract the flap well during the surgery. Although surgery usually begins with the dental mirror in the left hand of a dentist or an assistant, holding the mirror during surgery is not recommended. You must perform the surgery with the retractor in the left hand to open the flap accurately and obtain a better surgical view. I usually use 2 types of retractors, Selden retractor and Minnesota retractor. It's better for the person in the mouth corner to hold the Minnesota retractor. Therefore, the dentist performing the surgery should hold the Minnesota if the surgery is on the right side, and the assistant should hold the Minnesota if the surgery is on the left side. In actual surgery, the retractor should always retract the flap after flap elevation to obtain a good surgical view. Most beginners have the hardest time with suturing. The most important elements of suturing are tools and basic technique. To discuss the tool, first, a good needle holder must be used for good suturing. A good needle holder offers a good grip and possesses very fine tungsten carbide coating on the retentive tooth. These properties allow us to make thin sutures. Likewise, take a moment to see if there is a bevel on the middle tooth. If there is no bevel, the suture will constantly be caught by this region. That's why you must use a needle holder with a bevel. If there is no bevel, make sure you create the bevel by grinding it yourself. It'll make the suturing procedure much easier. This pair of Adson forceps is also important. There are Adson forceps with or without a tooth. Although it appears that the tooth can grasp tissue more efficiently, it actually damages the tissue during surgery. So it's better to use the forceps without a tooth. I recommend using Adson forceps with no tooth. Recently, I organized a kit called Basic Surgical Instruments under my name. While giving lectures abroad, I experienced many difficulties during practical sessions due to the tools. So I organized this toolkit for easier surgery. It contains almost all of the contents I discussed above. Take a look. It contains a fine needle holder, Adson forceps without tooth, a Selden retractor, a Minnesota retractor, a P24G periosteal elevator, and a suction tip. I'm sure most of you had no problem with the suction tip, but it can cause some problems at times. So make sure you use an open metal suction tip. This tool is called an Auschenbein chisel, and it's my favorite tool. It's extremely useful in performing alveolarplasty or simply collecting the chin bone. So I included this tool here as well. It's not the complete full set, but these tools will allow you to perform most of the surgeries. If you add basic tools such as a mirror and a pin set to this, it'll be a great tool set. This is the actual tool set that I use. I added a few more tools to the basic tools I discussed above. I always carry this tool set when I perform live surgery abroad because it allows me to perform almost all kinds of surgeries. Add your favorite tools to the basic set for easier surgery. At this point, we'll watch the video of my actual surgery to see how to use the tools we just talked about. This is a slightly lingually placed incision. Now we make a lingually placed incision. I approach most of the incision lines with mess number 12. If you're not familiar with the tool, mess number 12 can be quite unstable.
저도 12번을 이렇게 루틴하게 쓰는 사람을 별로 본 적이 없어서 그러긴 한데
I had no problem with mess number 15 before I started using number 12. Once I got used to mess number 12, however, I could no longer make the incision I wanted with mess number 15. Although it can be difficult at first, you will learn that some incision lines cannot be created without mess number 12 once you're familiar with it. You can add a fulcrum to the frontal tooth and simply retract the flap using my favorite P24G elevator. Use this healthy tooth and push gently for easy retraction. The elevator doesn't push. Instead, it adds and rotates. It opens the gap with rotation. If you push incorrectly, you can lose control and stab. It's important to rotate with support for retraction and retract the lingual flap slightly as well. Perform just enough retraction to see the lingual bone thickness. This simple flap retraction completes a clean incision line. You can see everything this way.
방향 앞으로 기울인다는 느낌을 그대로 가지고 있고 네, 지금 괜찮겠습니다. 치도 됐고 지금
The bone here isn't that hard at all. The bone tissue is somewhere between normal and soft bone. And I'll perform 4.0 drilling for starters. It's 4.0 by 8.5 millimeters. Although relaxing the open wrench from the outside doesn't seem like a big deal, it can result in a massive difference. People who perform the surgery with the open wrench inside the mouth will always face a problem. It can be hard to relax it inside the mouth, or you can even agitate the implant due to incorrect insertion. The open wrench must be rotated outside, and it should not enter the mouth. If the design were up to me, I would make it big enough so that the open wrench could not enter the mouth. At this point, I'll perform the implant while looking at the direction. You must not lose direction, not even during the implantation. I'll implant 2/3 and check the direction.
괜찮습니다. 해보십시오. 토크 봐주세요.
Torque is 26 newtons and is very well established. I'll now enter with a straight direction. Remember not to enter all the way from the start. Instead, check the direction and finish the work if you're satisfied with the direction.
Okay.
We must minimize the use of drive. Since it was relaxed once already, we can use our hands and detach it at once, like this. Suturing can be easy if the assistant helps you so that you have a clear view, like this.
Four zero요, 5 zero요? 5죠?
I'll start with the corner and proceed with a figure of 8 suture.
한번 figure of 8으로 가볼까요? 한 번에 가버리죠. 오케이. Yeah. 오케이. 네, 괜찮습니다. 거의 다 됐습니다.
I'll send the next one-point relay back to Dr. Lee Dae-hee, my closest friend and a respected clinician. I recommended Dr. E 1 year ago, and I'll return it to him again.